It's 5 o'clock? Oh, it is 5 o'clock. Tuesday, July 21st. I'd like to call to order the Administration Committee meeting. Can we do roll call, please?
Long,
Present?
Cook,
Present.
Ard,
Present.
Peterson, PV. All members present.
Pat, do you want to mention many others that are with us?
Yes,
to the meeting
I
today?
would. We have Adam Kostanek is here, Supervisor Dave Osnes, County Treasurer Denise Anderson, HHS Director Bob Rort. Welcome, Bob. IT Director John Allegro, Assistant Finance Director Leah Symington, and from Shelley Tugas from the library. And then online, we have Tara Davies Fox, HR Director. Let's see, Linda Skoglund from JA Counter, and her assistant, his name is Alicia Schwartz. And we have Audrey, last name Audrey Haycraft from our Human Resources Department. And is that everyone online, or did I miss someone? I can't see you all. Anyone else on the Zoom call? Okay.
Somebody say hello online. See if I can hear you.
Hello.
That works.
Perfect, thank you.
Yeah. And I think Scott Cox, the Corporation Counsel, will be joining us shortly, pretty sure.
Great.
So,
Thank you, Pat.
Thank you.
As far as the minutes from our last two meetings, do we have any changes, edits, adjustments? Neither were very long.
I would move to approve the minutes.
I'll second that. I don't think we need a motion, but if there's no edits, they'll stand as published. Okay, public comment. Do we have anyone from the public that would like to speak for the committee tonight? Public comment. All right, we'll move right into our business items. We have quite a few for tonight. So, Pat, I'll let you kick it off.
Thank you, Mr. Chairman. In your packets, you have the financial reports for the administrative departments, and this reflects financial activity for 6 months of the year. I reviewed both expenditures and revenues, and all the departments within the administrative committee are where they should be at 6 months in the year. In addition, you have in your packets a report on the capital improvement project status. It shows all the expenditures year to date for all the capital projects that the board approved. You also have a summary of the vehicle registration fees for the year to date, sales tax, and the contingency fund. In the sales tax area, we're looking at revenues year to date that actually look strong at this point in time. April of this year actually was an all-time record. We collected almost $1 million during the month of April alone. So we will be looking at May and June's sales tax receipts real closely. We don't really know exactly what to attribute the high sales tax earnings for the month of April. We think it may be a lot of online ordering that the county receives sales tax for, rather than shopping out of state or in the Twin Cities area. A lot of people were doing shopping online. A lot of home improvement sales. So we'll be monitoring that real closely. But at this point in time, the sales tax looks very strong, and vehicle registration fees are strong as well. So that's it for the financial reports, unless there's any specific questions. Ken Witt's here, and Leah is here if you have questions.
Just quick clarification. So given our circumstances with the pandemic, anything in particular that we should be aware of or concerned about?
Certainly, we're watching expenditures in the public health arena, the emergency management, facilities. The facilities director, I don't know if Jim is here, but his department has made some pretty major expenditures for building modifications and equipment and supplies. A lot of these expenditures are being recorded and coded separately, and the county has already made one CARES grant reimbursement request in the ballpark neighborhood of $150,000 for the additional expenditures that we've made because of the pandemic, and we're trying to record those very closely and try to recapture federal CARES dollars and state dollars that are available. So, thank you.
Okay, any other questions on finances? We'll move on to number 2, self-funded health insurance plan changes for 2021.
Yes, I'm going to just say a few words, and then I'll turn it over to the HR staff and Linda from JA Counter. JA Counter is our new health insurance plan advisor consultant. We've been real pleased with Linda and her team and the work that JA Counter is doing with our health insurance plan. And we've had several discussions with staff and with stakeholder groups regarding the future of our health insurance plan, how we can address increased costs and plan design. And Linda and her team have been very innovative in bringing suggested revisions to our plan, and you see those summarized in your packet. We have 8 separate recommendations that the administration is supporting. I'll let Linda explain those briefly, and then our intent is for the committee, hopefully, to answer any questions you have, and then to approve the recommended revisions, and then that becomes part of our 2021 budget submittal. So at this point, I'll turn it over to Linda.
All right, thank you. Does somebody want to give me screen sharing capabilities?
Yeah, is it a button not available to you?
It says the host disabled participant screen sharing.
Okay, that'd be me then.
Come on, Ken.
All right, we're covered. All right, folks, I am delighted to be here today. Thank you for the nice introduction, Patrick. Very excited to be a part of the team at St. Croix County, and just a little bit about who we are at JA Counter. My name is Linda Skoglund. I am managing partner and president of JA Counter. I've been consulting for over 30 years for employers in Wisconsin and Minnesota. And I'm, like I said, just delighted to be working with this outstanding team that you have on board. We are part of Alera, which is a nationwide firm doing employee benefits, property casualty, and wealth management. We're the 7th largest employee benefit firm in the United States. And we were built, basically we were and are continue to be built on collaboration. And so when I say collaboration, I'm saying collaboration within Alera, but also collaboration with our partners such as St. Croix County. We have just a wealth of resources to be able to share to help St. Croix County meet their goals and objectives. We did a pretty deep dive with St. Croix County prior to our relationship with them to just talk about some key goals and objectives that we see from a long-term perspective. And when we're working with employers, one of the things that we find, and again, in my 30 plus years of experience, is that when employers are firing on all 7 of these key performance indicators, things are going really well in the plan. And so you'll note the first 3 bullets are a little bit more employee focused, whereas the last 4 are more employer focused. But really, we want to make sure this is a big investment that employers are making in a total rewards package for their employees. So we want to make sure employees truly understand the value of their benefits. They feel supported before, during, and after the claims process. And employees are truly educated and engaged in their role in helping control costs long term. And then from the employer's perspective, we want to make sure that, we're dealing with compliance risk. We're helping with administrative ease. We're really truly looking at some very innovative cost management strategies for the county as we move forward. And then of course, this is just not a year by year thing. This is a long-term approach to a total reward package for employees. So I'm going to spend a little bit of time talking about how your plan is running compared to benchmark. Overall, the plan compared to benchmark is running very well. St. Croix County is currently about 1.7 below the national benchmark according to Springbuck, which is our data analytics tool, and running actually quite a bit better, than Preferred One's benchmark as well. When we look at our cost drivers, it's really most of our cost drivers are around the outpatient medical procedures and pharmacy. And then we do have higher than average utilization around emergency room spend. So we'll talk a little bit about how we might look at changing some direction in that, but through both education and perhaps plan design. When we look at how your plan is trending, when we look at projections and spending over the next 12 months, your projected need for basically a cost increase to the plan next year is about 6.82%. Most of our drivers are in the mid-tier spending level. So what I mean by that is while you have some members in your plan that are nearing your specific exposure on the plan, which is $110,000, a lot of your spending is coming in under that spec level. And where we can probably find the biggest impact when it comes to cost drivers are in the areas of orthopedic spend and pharmacy management. So we're working with the county to look at options in those areas from an overall claims cost management strategy. I'm really encouraged to see that you have a very high engagement in your plan at 89%. What that means to me is that there's only really 11% of your members that haven't sought care or haven't had claims in your plan. You might look at that as saying, maybe we want that lower, but we really do want people going in for their annual physicals and exams and making sure that they get things detected when it's little and a lot easier to fix and a lot less expensive to fix than waiting until things get big and blow up. So from a plan perspective, you're running at about 46% of your total aggregate exposure. Again, that's 8 months into the plan year. You have about 8 members that have claims that have exceeded at least 50% of your specific stop loss level. There is one that through June, one that actually hit your specific, and you'll probably have at least a couple more that we'll see through the month of July. So we're anticipating your stop loss renewal to come in shortly here within the next 2 weeks, and we'll be negotiating that as we move forward closer to your November 1st renewal date. So I'm going to take just a pause there. That's a lot of words in a very short period of time. Do you have any questions before I move on to some plan design recommendations for 2021? All right, hearing none, I will move forward. Your 2021 plan design change recommendations are based on the fact that we're projecting a 6.82% premium cost increase to the plan for 2021. So what we were looking at doing is how can we tweak the plan design a little bit one way or another to be able to offset that increase. So we looked at several different options, and we're recommending what you see on the screen, that these 8 benefit change recommendations for 2021. So I want to spend just a minute explaining each one of these and then open it up for questions. The first change that we're recommending is to change your underlying plan design from an aggregate deductible to an embedded deductible. So what I mean by that is right now, employees have, if you've got single coverage, you have a $500 deductible. If you have family coverage, if you have employee plus one coverage, you have a $750 deductible. And if you have family coverage, it's a $1,000 deductible. So if you have family coverage, that's $1,000 that your family has to meet before the plan starts to pay any amount of co-insurance towards your plan. If we switch to a plan that has an embedded deductible, what that means is you've got a $500 deductible per person, not to exceed $1,000 for the family. So this is going to help folks with family coverage, because instead of having to meet a $1,000 deductible up front, they'd only have to meet $500 if there's one member in the family that has significant claims. So I've got just an image to help explain what that looks like for you here. When you have an aggregate deductible, this is just an example. If you have an aggregate deductible, and let's say this family has got a $1,000 deductible, and Jamie had $500 in claims, Lisa had $200, and Anna had $150 in claims. On an aggregate deductible, they would not have met their family deductible. That's $850 in claims, and still their family deductible is not met. When you have an embedded deductible, Jamie had claims of $500. Jamie now has his deductible met for the balance of the plan year, and they've only got $150 left before both Lisa and Anna's claims would start to be paid at the coinsurance level. So I'm going to stop there very quickly. Anybody have any questions on that first plan change? All right. So that you'll see that actually has a rate increase, that has an impact of a rate increase to the plan. But it makes the plan, I would say, probably a little bit easier to explain, a little bit more tolerable for folks with family coverage to not have that higher family exposure up front. The second change recommendation is to to increase the out-of-pocket just slightly for the 2021 plan year. You'll see currently you've got a $1,750 out-of-pocket maximum. And when I say out-of-pocket maximum, that's a combination of the deductible plus the 10% coinsurance that employees would have to pay. So currently it's $1,750 for single. We'd be adjusting that up $250 for single, going from $2,500 for single plus one to $3,000, and going from $3,250 to $4,000 for family. The annual deductible would remain the same. We'd just be increasing the out-of-pocket, so you can see that the decrease in plan costs at 0.42%. The next change we're recommending is to actually add a separate out-of-pocket maximum for prescription drug copays. Currently, your plan enjoys a pretty low prescription drug copay of $10 for generic, $20 for preferred brand, and $35 for non-preferred brand. We would be one of the changes would be looking to increase that copay level, but putting a separate out-of-pocket maximum of $500 for single 750 for single plus one and 1,000 for family. That would have a rate impact of just less than 0.5% as well. One of the things that you saw in the benchmarking data that we had is our emergency room utilization is high. And when we study the data, we're actually seeing people using the emergency room for non-emergency type services. So one of the recommendations that we're looking at making, while it doesn't have a significant impact to the plan costs at 0.09%, increasing that copay slightly, we're hoping that we'll between that and providing education to the employees, we're hoping that will make an impact to the emergency room utilization. In other words, helping it go down. Number 5, we already explained we're looking to increase the copay for pharmacy, for prescription drug copays. But number 6, we're actually adding a benefit, making the benefit stronger in the area of preventive pharmacy. Now, the reason what we would be doing is actually waiving the pharmacy, the copay for certain preventive drugs. Preventive drugs are things that you would take to prevent something from happening. So, for example, high blood pressure would be a preventive type medicine. So instead of having a copay on that, we would have that be free under the health plan. And the reason we do that is because when we studied the data, we're looking at some gaps in care and some gaps in medication compliance. And by having those maintenance drugs, those drugs that people are taking to prevent certain higher cost claims from happening, by having that be no cost to people, we're hoping to increase the compliance of those drugs, thereby reducing some of those higher cost claims. The 7th projection or the change that we're recommending there's no change in cost to the plan, but what we would be doing is allowing people to get a 90-day supply of drugs at the pharmacy. Currently, if somebody's on maintenance drugs, they're any sort of drug that they're taking on a regular basis, they have to go to the pharmacy once a month to be able to get that prescription filled, or they can get it through mail order at a discount. By putting this plan in place, again, trying to enhance and increase that the compliance around people taking their medications timely, if they can get a 90-day supply at once, we're hoping that will improve compliance. And then the final change recommendation is in the area of the retiree plan. And what we're looking to do is sunset the retirees, meaning as of December 31st of this year, saying no, we will no longer offer retirees the ability to stay on the health plan. So anybody that's currently a retiree on the plan, or anybody that retires between now and December 31st would have the ability to stay on the plan as it stands today. But anybody retiring after January 1st of this year would not be allowed to stay on the group health plan, because there's lots of options available. So one of the reasons that we looked at that is because the active employees right now are substantially subsidizing that group of retirees that are staying on the health plan. And so the savings, that's the significant impact in savings, the $330,000 would be the impact by over time by sunsetting that retiree class. So if we made all of these changes, it would basically it would basically eliminate that 6.82% increase. It would be a net neutral cost for 2021. So that was a lot of me talking. Anybody have any questions that I can answer here?
Thanks, Linda. I have a few questions. My first question is, and I'm not sure if you can answer this or not, is how many employees currently take the family plan? And I don't know who might have that data. What percentage of employees?
Maybe Audrey or Tara. Did you get the question, Tara or Audrey?
Yeah, the family, right now you have, as of June, you've got 254 enrolled families on the plan.
And do you know offhand what the percentage of the total number of employees who take the benefits would be?
It's a little less than half. You've got 548 on the benefit plan right now, and of the 548, 254 have family coverage.
Okay. Okay, then my next question is with regarding the change for the separate out-of-pocket maximums for prescriptions. What, we know what percentage of employees meet those out-of-pocket maximums with their prescription costs already? So essentially, my understanding is that by creating this new, making change number 3, then those prescription costs wouldn't apply towards the out-of-pocket maximum, is that correct?
Yeah, the co-pays would be subject to a separate out-of-pocket maximum. So you'll see the plan impact based on the current data is about $35,000. So that's basically an estimate of the cost impact or the cost shift that would go to the employees in the form of a higher exposure or higher out-of-pocket.
Okay. And then my final question is, how many current retirees does the county have on the retirement plan?
35.
Okay, thank you.
Any other questions?
Questions? Doesn't look like it. I'm curious, from Pat and Ken, do you have any thoughts on the sunsetting the retiree eligibility?
Yes, I do, and I support all the recommendations that Linda outlined, and we've gone through these in a lot of detail, but I do have one suggestion that I would like to make regarding the sunsetting the retiree eligibility. I would suggest we revise the date that this would go into effect to July 1 of 2021. By doing that, we will give the workforce an additional 6 months to plan for eventual retirement rather than trying to force them into a decision between now and the end of the year. I've had a couple law enforcement employees approach me in the last few days requesting that I reconsider our recommendation, and I told them I would bring that in front of the committee, and I support the suggestion. It will reduce the savings to the plan. I don't know by how much. If it's proportional, it would be by half of what the projected savings are, but I would, I guess, defer to Ken or Linda to provide me a revised estimate, but I support all these changes. I do think that this is a good recommendation regarding moving retirees onto a different plan. But I would say let's give the employees a little bit more time to plan for their retirement. So thank you for asking.
So do we have any idea how that would impact the cost?
Yeah, the $332,000 that we project to save is as the retirees age off and become Medicare eligible. So it really just delays the savings by 6 months. So there's no direct cost amount. Really, that savings is, we're going to realize it over probably about a 10-year period. So it's 10 years and 6 months from now instead of 10 years from now.
Mr. Chair,
Yes.
I think it should be pointed out that when you retire, when you're a local employee under the Wisconsin retirement system, that there is an insurance program which is comparable, at least cost-wise, with what the county has to offer and has similar coverage. Employees do have to give notification of that to the state within 60 days, and they can be covered under that plan. So it's not as if the county is leaving these employees who will be newly retired without an adequate insurance policy. There is a system already set up in state government to provide that coverage.
Yeah, thank you, Mr. Coxon. I do have that actually displayed, that comparison displayed on the screen. So you can see the medical plan that's available. There are a couple of different plans through that program. One is called an access plan and one is a local health plan. And the difference between those two, they're the same plan design, but you'll see the difference in rates. The local health plan uses a narrower network. It's probably a little bit more limited in the form of in-network providers, whereas the access plan has got access to providers all over the country in network. So you do see the comparison up on the screen.
So then with that additional option, do we still need to delay the date on that sunsetting provision, since they have that option already?
I think it's imperative that we do. I've seen many people and work with many people on a daily basis who have not made retirement planning at the forefront. They're waiting. Persons actually should start their retirement planning well in advance of retirement. Unfortunately, many do not. And then they find in 3 months they're retiring and they have nothing set up. I think it is to our advantage, and certainly out of respect for our staff, that we give them this additional time to sit down, to be able to look at these issues and look at the insurances and programs that are available to them. It is going to be net neutral to us regardless of the extension. And I think this is just saying we value that you have been a staff member with St. Croix County. And this will give time for education materials to go out, for persons to speak with their retirement professional and take a look at what program is going to be best for them.
Can we entertain, or, I'm sorry, Supervisor
I'd
Peters.
agree with the supervisor also on the extension.
Linda, one question on extending that out. Do we have the ability to make a mid-year plan change like that if we know in advance?
Yeah, great question, Audrey. As long as it's communicated in advance, we have the ability to administer that.
Okay.
So we can entertain a motion to approve?
I would move to approve the health plan as presented with the change in the extension to July 1st of 2021.
And Supervisor Peters, second. I guess any further discussion? Yes.
I have one additional question. At the beginning of the presentation, it was suggested that there was significant stakeholder conversations with staff. I'm wondering if Pat or Ken or Linda can talk about what those engagement with the staff was and what their feedback is overall on the changes.
We have a health insurance advisory committee. It's a health and wellness committee that is made up of staff from all of the various departments that have had exposure to the recommendations that are in front of you. And we also solicit input from our staff advisory committee, which is another group of employees made up of various departments. And so we try to reach consensus, and for the most part we do, regarding these recommendations. And it's really it's quite unique because these are not administrative driven recommendations. They're recommendations that certainly come from our consultant, but they are also developed and worked with these employee groups. And so and we usually give them options for them to be able to kind of decide which recommendations they want to present to me, and then ultimately I have to take what they've recommended and then bring it in front of the committee. So I don't know, Ken or Linda, if you want to speak to the stakeholder input.
Yeah, just one addition to that, Mr. Thompson. So we had 2 meetings with that employee group, and then those were recorded, and we posted those on the bridge for all the employees to watch and view that discussion. And we did get feedback, so I know people were watching it.
Good point, thanks.
Okay, any other further discussion? We have a motion on the floor to approve the changes in the health plan with one change regarding the sunset retiree eligibility and extending that date to 7/1/2021. No, yes, 2021, sorry. Okay, all those in favor signify by saying aye. Aye. Any opposed? It passes unanimously.
Thank you.
Thank you, Linda.
You're welcome. Thank you.
Okay, we are ready to move on to the business item number 3 regarding budget amendment for additional compensation for public health and emergency management for excess hours due to our favorite COVID-19. Pat?
Yeah, first, we'll take up the library levy. We'll take that up first, but it shouldn't take too long. And then
Oh.
we'll get to that item.
Okay.
Okay, for the library levy, this is an annual exercise that the committee goes through to establish the library levy, and then this will go to the county board. And then it becomes part of the 2021 budget submittal. And Ken has worked up some numbers, and he has a resolution in front of you, and he also has some additional language too for an alternate resolution if the committee sees fit. So, Ken?
Yeah, actually, the assistant finance director worked up all the numbers for me, but I'll present them for you. So this is a straight distribution. In the past, we've done some reallocations around the Hudson Joint Library. There wasn't a request for that, so I presented it straight as a normal distribution with one addition this year that we haven't had in the past, so I wanted to explain that, and that was with the library hotspots. So a couple of months ago, there was a request that had come through for contingency funding for that, which we didn't have enough. And the administration committee challenged me with finding a way to put it into the budget. So in review with Corporation Council, we found this to be a means of funding those library hotspots. So we've allocated $720 to each of the libraries in the system. It will become part of that library levy, so they'll be able to fund 2 hotspots per year. And then overall, just the formula, it's all data-driven. So the number of circulations that a library has by their cost per circulation for rural households is how the numbers are calculated.
So let's talk about what we've done in the past 5 years, and so we can kind of lay some of these issues out on the table. If you recall, there was originally an agreement with the Hudson Joint Area Library regarding reimbursing any other libraries, any shortfall between what they receive for the library services from the county and the rural circulation funding they would have received if these municipalities and towns did not participate in the joint library. So there was a period of about 10 years. Oh, I'm sorry. I'll go back, and I'm sorry if I'm going to give a little more detail here, but I think it's important. There's also the issue of the exempt amount that a municipality needs to fund a library at to make sure that they're not subject to the county library tax. And you're nodding your head. Thank you, Ken. So what happened about 10 years ago is there was a mistake made, and there was a miscalculation for a long period of time in the amount of the exempt amount for the Hudson area library. And at that point, I was still trying to put the numbers together, but when that came to that realization, there was a shortfall. They were funding the library at maybe half of what they were supposed to. And so at that point, it created basically a financial crisis at the Hudson Area Joint Library. So now from that point, there's really two schools of thought. There's one version of the story that basically says they were in a financial crisis. They made a fiduciary decision based on sustaining the financial viability of the library, and then they decided to negate the agreement that had previously been made for payments to the other libraries. Then the other version of that story is basically there wasn't a financial crisis and they just arbitrarily decided to take the cash and run, and it was unethical and greedy. So now we're 5 years down the road, and during that 5-year period, basically the county penalized the Hudson Area Library and reduced their rural circulation funding from 100% to 70%. And then the additional 30% was reallocated to the other libraries. So we basically were penalizing the Hudson Area Library for the last 5 years, and probably to the tune, correct me if I'm wrong here, Ken, maybe in excess of $130,000, somewhere in that area. I'm sorry?
The current year would be about 26,000.
Oh, okay.
I have the current distribution on the screen
Okay.
there.
So maybe 125,
Yeah.
somewhere in that area. So I guess my contention on this issue is, regardless of what version of the story you want to believe, I think a good argument can be made that we've probably penalized them enough. Most of the people that were involved in that scenario are no longer there. They've been replaced with other individuals, so the individuals who are responsible for that decision aren't even in the picture anymore. And the other comparison I could make was, if you get in trouble with the local sheriff, you might spend, 90 days in jail or pay a fine, but at some point you've made restitution on your mistake, and it's good to move forward. If I can make one more comment. The other important thing to consider on this, though, is the other side of the story with regard to the reallocation to the other libraries. So last year we had a reallocation to, for example, River Falls for about $11,000. So I was really uncomfortable with that. So yesterday went down and met with the library director there, Tanya. I'm sorry, I don't remember her last name. And we had a really good conversation. And she was actually very, very appreciative of the fact that we reimburse the rural circulation funding 100% on our support for the library. She was respectful in any decision that we might made. Obviously, not getting 11 grand is going to hurt. I think all the libraries are hurting right now. I'm not going to mince any words there. Afterwards, I came back and looked at the difference between what Ken had prepared in terms of our reimbursement to River Falls and how that compared to last year. And actually, the reduction wouldn't be $11,000, but more like $4,400 because they had an increase in their rural funding circulation. So there was an increase in the funding there. So when I looked at all the libraries, the main ones that were impacted were anywhere from, somewhere in the $4,000 to $5,000 range, with the exception of Roberts, but they had a drop in their rural circulation numbers. So I'm encouraging us, I guess, to come to some resolution of the issue in some form or fashion. And so I'll leave it at that. Supervisor Peterson.
I guess I respectfully disagree in the fact that we are penalizing the Hudson Library system. Ken can correct me if I'm wrong, but they elected to pull out of our system with the promise to the county board at that time, and it's recorded, that they would make whole the other libraries that would be losing money if they came out and started collecting their own taxes, which is what they're doing. So essentially what they're doing is collecting taxes on their own, and subsequently have decided to withhold what they promised to give to these other libraries. So when we say we're punishing them, I disagree, because they're still collecting those taxes, they're still taking that money, and then they want to come into the county board every year and get their full 100% just like the other libraries. So in my oversimplification, that's double dipping in my mind, and I do not agree with that.
Broussard?
Mr. Chair, I am going to make a motion so we can get back on track with Robert's Rules of Order. So I'm going to make a motion that we approve the library levy utilizing the 2019 resolution language and updating the figures within.
Discussion.
Yes. Every library in St. Croix County, with the exception of the Hudson Area Joint Library, is doing their due diligence in service and circulation. We have the numbers in front of us for circulation costs. Anytime a library fails to participate in those circulation costs, every library takes a hit. And this has been an issue. I actually did a very thorough study on the Hudson Area Joint Library about 4 years ago, at the time when New Richmond was looking seriously at a new library building. And I found the library to be understaffed, under-maintenanced, with a number of significant issues. I found your staff to be extraordinary, working with very little and making the most of what they had to work with. It was what libraries are made of. But clearly, in creating the Hudson Area Joint Library, fiduciary responsibility was not at the top of the list. And I realize that the library has been suffering for that ever since, but it's time for its members to step up to the plate. They need to make right what was wrong so many years ago. And they need to become a team player with the other libraries which are in the IFLIS system and in St. Croix County. And unfortunately, this 30%, Hudson Area Joint Library is funded at 70%, everyone else at 100%, and then that 30% is divided amongst all the libraries. It's a very little piece of what should be happening. But at this point, every library in St. Croix County is struggling to make ends meet. If the Hudson Area Joint Library jumps in as a full team member and a full financial player, we're going to see a significant change in what our library systems can do.
I have asked the co-director of the Hudson Library, Shelley Tugas, to address the committee. I hope you're okay with that, just to give you a little better idea of the impact on their financial situation, which, and I totally agree that all the libraries are struggling for sure. This will give you a little bit of a taste for their situation, and I'm sure she'd be willing to answer questions as well. Shelley? Up at the podium, please.
Mr. Chairman, members of the committee, thank you for having me. I've been on the job for 4 weeks now and have done a lot to sort of catch up with the situation here in the county and our library and some of the bigger picture issues that have been brought up, and I really appreciate you letting me have a few minutes. You laid out the history very well, so there's no reason for me to cover that, and I do want to say I don't mean to come up here and armchair quarterback what happened. I believe people were acting with the best intentions, and They did the best they could in a difficult situation. I wasn't here. I'm one of those people who have inherited the situation from a previous director who inherited the situation from another previous director. So a lot of challenges. I would respectfully request that we could have a fresh start. And I know you have a lot of thoughts and opinions about that. Our patrons have also paid the price, and I know you object to the word penalty, but the redistribution. That $27,000, we could have a 30-hour weekly librarian delivering STEAM classes, teaching early literacy, and doing all of those day-to-day information requests from patrons. And I know you're going to talk a little bit about the impact that it has on other libraries and maybe have questions for me about that. And I think those are very fair questions. You're right when you say all libraries are struggling right now. My time with Hudson's history, with its funding, it is so complex and so unique. I keep thinking it could be like a Netflix show. It is really not something you would expect to see coming into this town if you read the history. And I can say that honestly, our library is in a funding crisis. And I'm using the word crisis relative to a pandemic, and I stand by the use of that word. We adopted a budget with a deficit spending of $75,000 for this year. And that deficit spending is not for capital purchases or technology purchases or to add programs. It's to maintain the operations that we have. To your point about the partners, the bigger picture, people stepping up, my goal is to start 2021 with a retreat of library stakeholders, Hudson Library stakeholders, and try to get us on a long-term funding solution to restore sufficient funding to this library. I don't think it's fair that we're here every year putting you through this, and it's no fun for our board or staff either. Please understand that. We've fallen so far behind our neighboring libraries in terms of wages. We're paying a little under $17 an hour, and commutable libraries are paying between $24 an hour and $41 an hour. So that's $8 an hour more to $25 an hour more. We've lost 16 staff over roughly a 2-year period, and that's a staff of 12 full-time equivalents. That's how many we have on staff. So you can see the turnover has really reached a very challenging point for us, and it's very expensive to continue to recruit, hire, and train new librarians. You know, if we had the budget we were legally mandated to have, but we never got, we'd be in the sort of River Falls neighborhood of about $2 to $2.5 million budget. And I wouldn't be here. I would be on First Street running a sufficiently funded library instead of the situation that we're in. I really do appreciate you hearing me. I don't want to take any more of your time. I am happy to take your questions and answer them to the ability that I can. If I can't, I will get the information and get it to you. And I'm also happy to take any questions about the service we've provided during the pandemic, which includes a virtual programming model that everybody in St. Croix County and Western Wisconsin has been able to access. So that includes communities that everyone here and the larger board represent. So thank you.
Does anyone have any questions for Shelley? Okay, thank you, Shelley.
Thanks so much.
So the motion on the table is to return to the allocation method employed in 2019. And we have a motion and a second. I would like to request a roll call vote. Oh, I'm sorry. I'm sorry. Go ahead, Supervisor Cook.
Thank you. This is a very difficult discussion for me. Obviously, my district includes the Hudson Joint Area Library and many of the residents that are served. I know it's also historically been an important issue for the former Supervisor Schoberg, who was in my seat before. It's challenging. I understand the reallocation in the previous years and the impact that it has on other libraries. But I also know that the library in my district is suffering. And I have received numerous calls from constituents asking me to support funding for our library. I think it's unfortunate that we have to, I feel like the issue has become fairly political. And I think that, I mean, ideally, we wouldn't have to be having this conversation every year. We'd have a resolution as our library director had stated that she will be pursuing, hopefully in the future, that can address this so we don't have to continue to have the conversation. But I have a very hard time voting against something that will harm the residents of my district, so I will not be supporting the motion at this time.
I'm just going to make one more comment before we vote. We need to move past this issue at some point and let our grudges go and move forward and try to help all of our libraries out. Any other discussion?
Yes.
Yeah.
I don't believe that this is of a political acumen within this body. It is about fairness to all of the libraries. And the Hudson Area Joint Library, its issues should be sitting with its board. Its library board of directors are the ones who should be addressing this deficit in operations issue. This is something that's been longstanding in not having funded sufficiently or having selected a property to move their library into that they could not sustain. This should not be an issue that is affecting funding of any library, but unfortunately, because of the failure of previous library boards with the Hudson Area Joint Library, it has now become a bigger issue to the point that it is affecting every library in the county. I totally support the library director's statements in trying to get the board, as well as other supporters of the Hudson Area Joint Library, step up. Fund your library as it should be. River Falls did their addition and renovation by having their members and members of other communities who utilize that library step up. Roberts, Somerset, New Richmond with the extensive programming and outreach. All of our libraries have stepped up and they have asked their members to step up with them, and they have done so everywhere except Hudson Area Joint Library. This is an issue that the library board, as far as their deficit in operations, they need to address that and get back into the game as a team player. For myself, at a point when the Hudson Area Joint Library can bring its funding up and can show that they are moving forward and sufficiently funding their library, then I will support them at 100%, but not at this time.
Supervisor Peterson.
I would just add to that last year I said, you know, I would welcome them, or in fact, the board would welcome them back into our system. And so I think, maybe along with what Supervisor Art is saying, it's kind of indicating to me that, no, they don't want to support their library at the rate that the rest of the county supports their libraries. And that's their decision. And so that's why I will support this.
Keep in mind that some of these municipalities may not have a choice in additional funding on the library due to their levy limits. So it's not necessarily a matter of we don't want to support our library. It's a matter of we don't have the funds unless we go to our constituents and ask for a tax increase. Yes, Supervisor Peavy.
Just a couple quick comments. I sat in this room when the Hudson Library said they would make these payments, and it wasn't the person making the promise, it was the Hudson Library Board. So I fully support Supervisor Peterson's and Supervisor Ard's comment. I think one thing we're missing, and Ken can help me if I'm wrong, we're talking about a $1,135,000 tax on the towns. This doesn't go to the cities and villages. This only goes to townships. And this is a property-based tax. So we're talking $1 million, and every cornfield, every lot, every cow, every pasture pays tax for the library. And I'm sorry, I got some smart cows when I leave a gate open, but they don't use the library. So, I think we gotta remember that $1 million we're talking about. That's a huge, huge tax. In the township where I'm clerk, we pay more in library tax than we do for fire protection. So this $1 million is getting to be a little bit out of hand. But I will support Supervisor Ard's motion, and I think we should reallocate as the chart on the board indicates. Thank you.
Yes, I think we're ready to vote.
Long,
No.
Cook,
No?
Ard,
Yes.
Peterson,
Yes.
PV.
Yes.
Motion carries.
Okay. Thank you for that discussion. That was really important for us to have. I appreciate and respect everybody's opinion. And I apologize for the agenda. I had an old copy, thank you, Shelley, of the order, so
That's okay.
It was reordered a little bit after where I made
Yeah.
my copy of the agenda, so sorry.
Thank you,
about that.
Shelley.
Okay, now, after the library, we can
Yes.
move on to number 4, the budget resolution for additional comp for public health and emergency management for excess hours due to COVID-19.
Yes, thank you, Mr. Chairman. This is a resolution which will amend the 2020 budget to allow for additional compensation to be reimbursed from the federal CARES grant. We have 9 employees. After the assistant county administrator analyzed over the last 8 months of all salaried employees, pre-pandemic and post-pandemic, those hours, and we've determined that there are 9 employees that should be compensated for additional hours over and above their normal work schedule. These are salaried employees, exempt employees, employees that are not eligible to be compensated for overtime hours in excess of their normal work schedule. You have the list of employees in your packet. As I said, it's 9 employees. 8 of them are from the Public Health Division, and 1 is from the Emergency Management, Emergency Support Services Department. The administration supports this effort, and the time period is from March 1st through June 27th of 2020. And if there are additional hours between June 27th and the remainder of the year, the administration will bring forward a resolution to the board at a later date if we deem appropriate. Total cost of the budget amendment is $49,352.
And that, if I'm not mistaken, is covered in our COVID grants from the state?
Yes, it will be reimbursed
Reimbursed.
through the CARES funding.
CARES.
I'll move for approval.
Second, Motion by Supervisor Cook, second by Supervisor Peavy. Discussion. Any discussion? Supervisor Ard?
We may not be out of this yet, looking at the current numbers. We may just start seeing these peaks coming. So given the significant number of hours that all of our public health and HHS employees are putting in, this is certainly the right thing to do. And certainly I would agree that as much CARES Act funding as we can utilize to guarantee them coverage of their hours, we should.
Any other discussion, comments? Let's go ahead and vote. All those in favor?
Aye.
Any opposed? Motion carries unanimously. Okay, if I'm looking at the right agenda, the next item would be a resolution to repeal Resolution 15, COVID-19 Emergency Declaration.
Yes, thank you, Mr. Chairman. In March of 2020, actually March 16th, the County Board of Supervisors passed Resolution number 15, 2020, declaring a state of emergency in St. Croix County due to the COVID-19 pandemic. That resolution authorized the county administrator to take certain actions to address the county's response to COVID-19. I've reported on those actions taken per the resolution on a monthly basis to the board. And this resolution also, in addition, allowed for remote attendance for staff and county board supervisors to allow for social distancing. This resolution is set to expire September 16th. So the board, the committee, and the county board have the option to repeal it, extend it, or let it expire on its own. So you have, by taking no action, it will expire. The board has the option to extend it or to repeal.
Supervisor Peterson.
Chair Robert, I would like to make a motion that we, at this time, considering the retirement of our administrator and the times, I would move that we would choose to extend the existing resolution 15-2020 until December 31st of this year, thereby giving us some time to have another look at it. And with our administrator leaving, I think it's just a good thought.
Discussion. I think that certainly makes sense in my mind. As Supervisor Ard pointed out, we don't really have any idea what we're facing coming down the road. And it does give us additional flexibility to respond based on what's happening. And I believe it also eliminates an agenda item. Nice little consequence.
A little bonus there.
Little bonus. Comments and suggestions?
Given the current numbers that I'm seeing on the Wisconsin State Health site on DHS and the numbers that I'm receiving through our Salvation Army HQ, we're seeing spikes happening in and around St. Croix County. With all of the education that public health has been doing regarding the use of face masks, social distancing, we still have persons who are gathering, no face coverings, large crowds, and of course, families want to get together. People are cabin crazy. It's summer. It's going to happen. Therefore, I think we may not yet have seen our peak. I think it's still coming, and we still have a great deal of education of the public to do. So I'd say this is a very wise move on our part. We need to be prepared to act in a minute, anytime the call comes.
Any further discussion? So the motion on the floor is to extend the emergency declaration till the end of 2020. We'll vote on that now. All those in favor?
Aye.
Any opposed? That passes unanimously. Thank you. And that also eliminates number 6, I believe.
I believe it does, Mr. Chairman. This was a resolution that was prepared in anticipation that the committee might choose to repeal the emergency declaration, and part of that declaration allows for remote attendance by board. So by extending the declaration, which you have done, this makes this point moot for all practical purposes. But at some point, the board, the committee and board may choose to take up this issue as a matter of course through your discussions with your bylaws.
Okay, so that moves us on to number 7, resolution amending the investment policy.
Yes, thank you, Mr. Chairman. I'm going to let Ken Witt explain the revisions to the investment policy.
Thank you, Mr. Chair. Mr. Thompson. So the investment policy is being requested to change to allow for additional investment vehicles. As a government entity in Wisconsin, we are very limited on what we can invest in, and our policy reflects most of those investments, all but one. We are allowed to invest in AA corporate securities. They're very safe. I have a chart on here I'll show you that sort of illustrates that point. But it's an additional vehicle tool that our investment advisor has requested that we get access to invest in. He thinks that it'll expand our options, provide more opportunity for greater returns. He's looking at some corporate securities that have a variable rate attached to them. When you buy treasuries and stuff, there's no variable rate, they're fixed. But a corporate security has different options which have variable rates, which will adjust as the market starts to come back up. So if we can get into it now, and as the market comes up, those will adjust instead of locking into a treasury, which is fixed at a very low rate. So that was the request. And then I was going to show you in the packet. So this chart here with all the very tiny numbers on it. So AA security, if you follow that chart column down, if you get all the way down to 2008, I'll sort of highlight it there. But in 2008 was the last time that a AA security had any type of default. And so when you look at what the risk is, because treasury bonds are very secure, corporate bonds do have an element of risk, but it's been since 2008 that there's been any default in a AA corporate security. Our investment policy change that we're requesting is to allow for up to 25% of our investment portfolio to be invested, and then there's also a limitation on the total amount that can be invested in any single corporate security. So we do diversify even amongst that framework to different corporate securities. So again, there is an element of risk, but it was deemed safe. The investment committee did recommend this change.
The up to 25%, is that
$30 million.
That seems kind of high. No response to that, huh?
Well, yeah, I guess that's subjective. So the investment portfolio that we're looking at, so we invest about $30 million with this investment advisor. And 25% of that then, is several millions of dollars. So it's all in your appetite, I guess, for risk.
Questions? Supervisor Cook.
Thank you, Mr. Chair. Ken, are there other counties that are also investing in these corporate securities as well? And do you know what their performance has been to this point?
I do not. So our investment advisor does do several of the counties in this area, and I did not ask him that question. So I don't know if he was taking it from other investments that he has with other like Wisconsin counties or not.
Anyone like to make a motion? To approve or otherwise?
I'll move that we accept the recommendation.
Second.
Second? Any further discussion or questions for, yes, Supervisor Peavy?
Yeah, I guess I'm uncomfortable with the 25% of maybe invest in corporate securities, so I guess I'd make a motion to amend the original motion to lower that to 20%. See how this goes for a couple years and then move on from there, but I would move that we lower I'm looking at the line, but I don't know how to word it, but it says not more than 20% or 25%. I would amend that to not more than 20% of the county total investment portfolio may be invested in corporate securities, and then goes on from there. Okay.
I would, yeah, I think that's a good idea.
Okay.
So is that a separate motion, or can we, okay, yeah, that was a separate motion to amend the initial,
Well, we actually we both agreed to amend it.
The originator of the motion accepted the amendment by the originator of the amendment, and so therefore, you can.
what's that? Oh, yes.
So you have a motion to amend the main motion. So the amendment to the main motion is to reduce the allowable amount to 20%. And that's what, was there a second to that motion?
Actually, I agreed, I made the original motion, and I agreed to accept his recommendation and amend my original motion, and the seconder also agreed. So,
Does anyone object to that?
No.
No.
Okay. And with consent, you can, that's now on the floor of the 20%.
I'm sorry? It's a roll call vote. Okay, so the motion on the floor is to accept the change in the investment policy with the change to reducing the maximum amount from 25% to 20%.
I'll take the vote. PV?
Yes.
Peterson?
yes.
Ard?
Yes.
Cook?
Yes.
Long?
Yes.
Okay. Motion carries.
Thank you. Okay, I believe the next item, if I have the right agenda, is the report on mandated services.
Yes, thank you, Mr. Chairman. In your packet, you have a lengthy report, which has been thoroughly vetted and prepared by our Corporation Counsel. And what this is a department-by-department list of services provided by the department, and notes whether or not the service being provided is legally mandated by the state of Wisconsin, and if it is, statutory cites are made, which cites the statutory provision which mandates the service. And this is a good report. There's no action that's required. Those of you that have read it, you could ask questions, surely, of either me or Scott Cox or Ken. But otherwise, I would say this is a report for future reference when the board goes through a strategic planning session. You will be able to refer back to this report and the good information it contains to determine priorities for the board. And sometimes it requires the knowledge of whether or not the service that's being provided is actually required. So we're open for discussion at this point, but there's really no action to take on this item. But Scott's here if you have any questions regarding how he prepared this.
I just have a comment. Scott, this is excellent. And I have, from the League of Wisconsin Municipalities, all of the mandated requirements within the state of Wisconsin for local, county, and state government. And this far outdoes any information. It's amazing. Thank you so much.
This was something that the board had asked for be completed, and so it was part of the county administrator's work plan, but I have to say kudos to Scott and his office for working on this.
And also, so this is an updated report from, I think, 2011 or 2012. And thanks should also go to the department heads who first did their homework, and then basically I checked their homework. And so this wasn't just the work of our office, it was the work of all departments in gathering this data, gathering the summaries of what they do, and then cross-referencing whether the service is mandated or not. And the only other thing I have to say about this, although there's some things that are listed as non-mandated, like virtually all of human resources, virtually all of IT and building facilities, we couldn't possibly, for example, human resources, although the state doesn't mandate a human resources or personnel department, the county has upwards of 27 or 28 state and federal laws that it must administer and enforce and comply with in HR. The same thing with IT, same thing with facilities, in which they have to have the knowledge of building requirements, American with Disabilities Act, etc. So just because a service is listed as non-mandated doesn't mean that it is important, or I would say legally important for the county to do.
Thank you, Scott. Thank you, Pat.
Thank you.
This will be great for setting priorities. It's a great tool to use, so thank you. It's really a value, I think.
Thank you.
Okay, any other questions or comments on this item? We'll move on to the resolution approving the county administrator's work plan report for July 2019 through June 2020.
Right. Thank you, Mr. Chairman. This is a report on the work plan that was established by the board for county administration a year ago. There were actually 6 or 7 work items in the work plan. I'm not going to go through this item by item, but it's all spelled out in there, and I think we made good progress on all of the goals. Most of them have been completed. One of them we just discussed with the mandated services. We've implemented the McGrath compensation study. We've addressed the regional crisis intervention with the Hudson Hospital and the providers in St. Croix County. The Community Development Department completed the nitrate source analysis, and that was one of the recommendations in the water quality study completed a couple of years ago. We just reported back to the board at our last board meeting on the space needs study for the government center campus for future expansion. And the final goal was to try to increase the health center campus bed utilization. And we were on track to meet this goal, and we did receive the home and community-based waiver, and then COVID hit, and so that has kind of stalled our ability to fill all the beds at the nursing home. But we were making good progress towards that, and I feel once we get through the COVID-19 pandemic and we have the home and community-based waiver, we'll be able to reach this goal and probably exceed it, far exceed it. So I think it's a good plan. Just a reminder that, you know, these aren't items that, I mean, the administration assists the board in developing these goals, but these are board objectives. And so, like last month's meeting, I presented the government space needs plan, but for future expansion, that's not something I dreamt up. It was actually something the board asked for. And so, and I know it was a lot to absorb, and that plan will take a lot of scrutiny and a lot of discussion by the board before you proceed, but I think it was a good plan. I think it is a good plan. So this is a resolution that'll go in front of the board at our next meeting.
So the resolution is to approve the county administrator's work plan report for that period of time. Do we have a motion to approve? Moved by Supervisor Peavy,
Second.
second by Supervisor Ard. Any further discussion? Supervisor Cook?
Pat, I have a question. Do you feel that the process to create this work plan works? It makes sense. The current process that is used, does it reflect the work that the county administrator is doing? Does it reflect,
I think it's a bit cumbersome, the process that we utilize to develop the work plan, and sometimes the process of going through the actual performance evaluation can get a little bit cumbersome. But I think for the most part, it's a very worthwhile process. I think the board needs to identify a work plan for your county administrator and really determine what areas do you want the administration to focus on for the upcoming year. And so the next agenda item is a resolution that will discuss possible work projects for the next year. So when I prepared this, that was before my announcement today. So this next agenda item, I would probably suggest you may defer until you have a new leadership established. I think they're good ideas. I had some input into these along with Ken and the staff, and so I think the 4 objectives that have been identified are good. But the board, this committee and the board may have other ideas and other priorities that you want administration to focus on. So I think give this some thought. You don't have to take action on the last agenda item tonight, but I think you should, as a committee, give it some serious thought as you transition into new leadership. So long answer to your good question, I think it's a good process.
Any further discussion? The motion on the table is to approve the work plan report. All those in favor?
Aye.
Aye. Any opposed? That passes unanimously. And then the last item on our agenda is for the next period of time. I think it might make sense to defer this, and I would agree with
I
that.
would.
But I would ask, although if anyone had any particular suggestions that we might want to think about as we're in addition to or any changes in some of the items that were already listed in the resolution? I didn't see it. I had one. So one thing that I thought about, and I was really glad to see, improving employee engagement. I think that's really critical and very important to make sure that the employees in the county are satisfied and happy with the work that they're doing. My other thought was, are there ways or methods that we might be able to gauge the effectiveness of our service delivery to our citizens? Because that's kind of basically what we're here for. We're here to serve our citizens. How are we doing? I don't know that there's really good ways to measure that or gauge that, but it might be something that we might give some thought to. At least maybe part of the plan might be to determine are there ways that we might be able to gauge our effectiveness in our service delivery.
There are ways, and communities all across the country survey their citizenry. There's good ways to survey, and there's not so good ways to survey. So, but a lot of communities do that, and counties do that all the time. And I'd have to look back, but I think we did make an attempt at doing that back in, I want to say 2012, 13, with UW Extension. We did a survey with the public, and I think it'd be an excellent goal. But once you do that, you can discuss how best to complete that survey.
Okay, let's see. I believe that brings us to the end of our agenda item. Are there any future agenda item requests for next month?
Yes, Mr. Chairman, I'd like to request that the committee schedule a special meeting to discuss transition and process. And I would request that meeting be scheduled very soon, within the next few days, if possible, depending on your schedules. I would say either later this week or early next week. The committee should schedule a special meeting, and a portion of that meeting will most likely be an open session, and a portion of that meeting may be in closed session.
Okay, well, that's a fairly immediate meeting. I'd like to suggest early next week, if possible, just to give us a few days to plan ahead. Would it be possible to do early morning? Just throwing out some suggestions. Any day but Monday.
We're talking next week, right?
Yes.
Tuesday would be the best.
Tuesday? Supervisor Cook, how does that work?
Tuesday, as long as it's, I mean, as early as possible.
6 a.m.
I can be here as early as you want to make it.
How early would you like to make
I
it?
can be here as early as people want to be.
800, would that work? That's when you.
8 o'clock?
That's a door open, Ken. 7:45.
Well, I mean, we can make it open, or we can make arrangements.
I think 8. Is everybody agreeable with 8?
Eight.
Work for you, Carl?
Okay, 8 o'clock on Tuesday, what would that day be? What's 28th?
28th,
Okay.
Tuesday at 8. Okay.
Okay, yes, sir.
I'd just like to say to the administrator, thank you for your service, for all the time you spent with us. I'd like to publicly acknowledge it. I thoroughly enjoyed working with you and the work you've done for our county. Thank you.
Amen. I think everybody would echo that sentiment.
Thank you.
Other future agenda items, announcements, correspondence.
Announcements, there'll be a committee of the whole meeting coming up on August 12th.
August
That meeting's going to be at noon because the county boardroom is occupied with a jury, which actually I'm going to need to check next Tuesday to make sure it's not occupied for jury there. We could meet in a different room, but it wouldn't be broadcast then. For
And
next
did you say
Tuesday.
noon?
Yeah, noon on August 12th.
12th, okay.
Wednesday, I believe.
Okay. All right. Well, I guess that will do it. I didn't do as well time-wise as I did last time, but 6:36 isn't too bad. So we are adjourned for tonight. And the next meeting, other than next week, our next regularly scheduled meeting, I don't have the date of. 18th. Okay, thank you, Ken. Isn't this fun?